Good evening. We can continue our discussion of the heart with the cardiac conductive system. This is a group of specialized cells that transmit electrical signals, causing the myocardium to contract in an organized fashion, allowing for blood flow. Cardiac cells are notable for their properties of automaticity, excitability, and conductivity. That is, the ability to create an electrical impulse without being stimulated from another source, the ability to respond to an outside stimulus, and the ability to receive an electrical impulse and conduct it to an adjoining cardiac cell. To emphasize the point, the conduction system consists of specialized electrical or pacemaker cells arranged in a pathway. The normal heartbeat begins with the firing of the SA node, located in the upper posterior portion of the right atrium. The system continues through the intraatrial and internodal pathways. The internodal pathways intersect at the AV node. This is the link between the atria and the ventricles in the conductive system. As the impulse enters the AV node, a delay occurs in conduction of the impulse to the ventricles. The bundle of His is located in the upper portion of the intraventricular septum and continues the electrical signal through the right and left bundle branches and the Purkinje fibers. Each portion of the conduction system has intrinsic rates at which it is capable of maintaining. The SA node is noted at a normal range of 60 to 100 beats per minute. The AV node is noted at 40 to 60 beats per minute, and the Purkinje fibers at 20 to 40 beats per minute. The heart is affected by both the sympathetic and the parasympathetic division of the autonomic nervous system. The terms used to describe the effects are chronotropic, inotropic, and dromotropic. This refers to a change in rate, a change in contractility, and a change in conduction speed, respectively. Sympathetic stimulation is known as an accelerator, and the parasympathetic stimulation is known for its inhibitory effects. The primary neurotransmitters for the sympathetic nervous system are adrenaline and norepinephrine, and the primary neurotransmitter for the parasympathetic nervous system is acetylcholine. The heart has sympathetic innervation at the atria and the ventricles, and the parasympathetic innervation at only the atria. Let's make a jump to how we view the conductive system of the heart. The triangle here shows the views of the heart with each of the limb leads placed on a patient. These are known as bipolar leads, as indicated by the positive and negative symbols. The placement of electrodes allows us to capture images of the conduction system and illustrate them as waveforms to measure. This is an example of what a single firing of the heart looks like and is typically displayed on a coordinate plane, with the x-axis representing time and the y-axis representing frequency. A series of large and small boxes are present to measure amplitude and time. We can identify each of the frequency changes with conduction moving through the heart. The P wave representing atrial depolarization, the QRS representing ventricular depolarization, and the T wave representing ventricular repolarization. We can use the timing of these events to determine illness or injury in the heart and abnormal rhythms. A few parameters worth noting are the PR interval, the QRS, and the QT interval. The PR interval measures between 0.12 and 0.2 seconds. The QRS less than 0.12 seconds, and the QT interval between 0.4 and 0.44 seconds. When identifying rhythms, there are 5 steps used to make a determination. The first step is to identify if the rhythm is regular or irregular. Next, determine the rate of the rhythm. Then look to see if there are consistent P waves. And finally, we need to measure the PR interval, then the QRS. These steps allow us to determine where the rhythm may be originating and allows for adequate treatment modalities. This is a lot of information that takes a bit of thoughtfulness and repetitive study to begin to understand. The best I can say is that individually, none of the components of the cardiac cycle are difficult to comprehend, but as a system, it quickly becomes difficult to recognize the interplay. Thanks for listening. Have a good night.